Okay, so this is going to be my week 6 health assessment video. So it's going to be my cardiac assessment. So the first thing I'm going to do is just knock on my patient's door, provide privacy behind me, do my hand hygiene as I walk in. I'm going to acknowledge my patient, introduce myself, just kind of state how long like my assessment's going to take, and then explain to them what I'm going to do. And then I would thank my patient for letting me do an assessment. After that, I would identify my patient and I would have them state their name and their date of birth, and I would just match it with their ID band. Next, I would assess for any pain and I would assess for any allergies. So starting off, I would just do like my inspection portion. So first, just like a general survey, looking at my patient. I want to make sure that their skin tone is even and like a consistent color, that they don't have any cyanosis. Next, I'm going to inspect their just kind of look at their carotids. I'm looking for jugular vein distension, and then I'm also looking for any like carotid pulsations. So a little bit is okay, but you may not see them as well, and they shouldn't be like very prominent, and they shouldn't be increased. On my JVD, I would check my right side first, and then I would check my precordium for any lifts or any heaves. And then after that, I would check my patient's feet for any pedal edema. Next, I would move on to palpation. So I'm going to go ahead and just check my patient's cap refill. So I'm going to just push on the nail bed here, and it should come back pretty quickly, like 1 to 2 seconds. And I'm going to do it on both sides, just because in case they have different blood flow in another arm, I don't want to just base my assessment findings on one hand, you know. Next, so I'm going to assess for my carotid pulse. So I'm going to do them one at a time. And then while I'm doing my carotid pulse, I'm also going to assess for any thrill. So that would be like a vibration. So I'm going to go ahead and start over here. And I don't feel a thrill. And I also don't feel a thrill on that other side. So my carotids are 2+ bilaterally. It's a regular rate and rhythm. Like I said, my thrill is absent. And then I'm going to assess my apical pulse. So it's going to be midclavicular, left midclavicular line, 5th intercostal space. So I'm going to just kind of go here and palpate there. And the apical pulse span is about 2 centimeters. So next, I would move on to my auscultation. So I would want to do this over bare skin. And then while I'm assessing my apical pulse, I'm going to listen for a full 60 seconds. So I'm going to go ahead and start with my apical pulse. And that's going to be the left midclavicular line, and it's going to be the 5th intercostal space. So the space where I just palpated. And I would want to do that for 60 seconds, and then I would just note that it's regular and it's a consistent rate and rhythm is even, basically, is what I'm trying to say. So next, then I would move on to my heart sounds. So I'm going to start with my aortic. So that's going to be my 2nd intercostal space, right sternal border. And then I'm going to move over to my pulmonic. So that's also going to be 2nd intercostal. It's going to be left sternal border. Then I'm going to move to my Erb's point, which is going to be 3rd intercostal space, left sternal border. Then I'm going to move to my tricuspid. That's going to be 4th intercostal space, left sternal border. And then I'm going to move to my mitral, which is going to be the 5th intercostal space, left midclavicular line. So the same place that I would feel for my apical pulse. So when I listen, my S1 and my S2 are present. My S1 is louder at the apex, and my S2 is louder at the base. And then for the Erb's point, S1 and S2 are heard equally. And then after I do my diaphragm, I would want to go through and just listen with my bell. just to make sure that I don't hear any murmurs present. So I would just do the same landmarks that I just did. So I'm going to do aortic, pulmonic, herbs, tricuspid, and then mitral. And then that concludes my assessment. So I would reassess my patient's pain. I would ask if they, or I guess offer if they need any, like anything to drink, or if they need a blanket. Then I would just ask them if they need anything else before I leave the room. I would thank them, and then I would do my hand hygiene on my way out. And that concludes my assessment.